Welcome to week 5 of the Applied Epidemiology module. In this session, we will talk about confounding and effect modification. And this first part of the session is particularly focusing on confounding. Confounding is a very important concept or issue in epidemiology, and in fact, whichever part of public health or epidemiology you will work after your MSc program or MPH program, it is highly likely that you will be forced to think about confounding quite a lot. Either you read about work done by others, or you design or do your own projects in epidemiology and public health, you need to consider confounding in deep details. Confounding is an issue that is not very easy to understand, but I'm hoping by the end of this brief video you will get a better grasp of this concept. But before I talk about exactly what confounding is, I want to say a few words about epidemiology in more general. As we talked about this before, one of the main aims or central goals of epidemiology is to find an association between a risk factor and a health outcome, between smoking and lung cancer, between work stress and heart attack, between gardening and mental health. But you also know that finding an association between any of these risk factors and health outcomes is just the first step in the long journey towards understanding or establishing the causes of a certain disease. So you may have seen this statement or this sentence before, which is, I think, one of the most important sentences in epidemiology. Association is not a causation, but it may be. And what this means is that when you do find an association between a risk factor and the health outcome, before you can begin to think about whether that association is perhaps a causal association, you need to exclude a number of so-called alternative explanations, which may be also responsible for the observed association and which may undermine your causal understanding. So what are these potential alternative explanations? This can be chance, bias, reverse causation, or confounding. So as you can see, confounding is one of these potential alternative explanations which may be responsible for an observed association other than being causal. Confounding can be very subtle, and in fact some of the authors say that confounding is the biggest challenge in causal epidemiology. And as I said before, understanding what exactly confounding is not that easy, but the best way to understand it, to have a good grasp, is through examples. So that's what we are going to do now. We are going to through a number of examples that will hopefully help you see or understand what confounding is. This is my first example, which we asked you to take a look before starting to watch this video. This question and image was published in a UK newspaper at the very beginning of the COVID pandemic. And they ask, is baldness a risk factor for COVID-19 infection? And this image illustrated shows data for results from an actual study that suggests that men with no hair or hardly any hair on the side have significantly higher, more than 40% higher risk of becoming hospitalized due to COVID-19 disease. So why can this be? Is this a real association? Does hair loss lead directly to severe COVID-19 disease? If the answer to this question is yes, that has serious public health implications, because in that case we need to spend lots of money in improving the hair situation of the population. Maybe we need to spend money on hair implantations or various chemical treatment to make man hair grow back, and this way reducing hospitalization rates due to COVID-19. But is this the case, or is there another explanation that may be responsible for this finding? For example, is it possible that people or men with no hair are older than men with more hair? And the reason why they are more likely to be hospitalized due to the infection is because they are older. I think this explanation is much more likely. So here what association we looked at is the link between hair loss and COVID-19 infection, and age acted as a confounder. So the original association is a confounded association, and the real association is between hair loss and age and COVID-19 infection. Confounding often can be illustrated very nicely with these triangles, as you see it here. This is my second example. Let's imagine, we don't need to imagine, there is an existing study that showed that people who regularly use sunscreen in the summer have significantly higher risk of developing skin cancer compared to those who do not use sunscreen. How can this be? Don't we use sunscreen exactly in order to prevent, to avoid developing skin cancer? If sunscreen use increases the risk of skin cancer, we should not use sunscreen at all. But is there another potential explanation that may be responsible for this finding? Of course there is. So it is established, or the study that described this association also found that people who use sunscreen regularly spend much more time on the sun compared to those who do not use sunscreen. And the reason why sunscreen users are more likely to develop skin cancer is because of the time they spend in the sun and not because of the sunscreen use. So once again, the relationship between sunscreen use and skin cancer is a compounded association, and the time spent in the sun is a confounder here. There are plenty of other examples in epidemiology textbooks for the issue of confounding, and I highly recommend to take a look at them, because the more examples you read, you understand, you think about, the better your understanding will be around this concept. I have one more example for you. This example is a bit more complex and adds another level of complexity to this issue of confounding. So it is very well known that there is a strong relationship between income and cardiovascular disease. People in lower income have higher risk of developing cardiovascular disease compared to those on higher income. But we also know that people in lower income are more likely to eat unhealthily and do less physical activity compared to those on high income. So is this an example for confounding? Can we say that the relationship between income and cardiovascular disease is a confounded association with physical activity and diet are confounders? Please think about it. Pause the video for a minute or two and then resume. From statistical point of view, a confounder needs to fulfill 3 specific criteria. The confounder must be significantly associated with the exposure. It must be significantly associated with the outcome. And the third criteria is that it must not be on the causal pathway between the exposure and the outcome, because if it is on the causal pathway, then it is called a mediator and not a confounder. So in this example, can physical activity and diet be a mediator instead of a confounder? For example, is it possible that people have poorer diet and do less physical activity because they have lower income, and they develop cardiovascular disease because they have poor diet and they don't do enough physical activity. I think it is absolutely possible. So the causal chain may go through these lifestyle factors, and they can definitely be called mediators instead of confounders. However, there are many different pathways how low income may lead to higher risk of CVD. One of them, for example, is the so-called psychosocial pathway, which does not include these lifestyle factors, but connects income and cardiovascular disease directly. So if you are interested in that particular pathway, you may consider physical activity and diet as confounders. So what I can say is that deciding whether a third factor is a confounder or a mediator can be often very difficult. And to make this decision, you often need to have a very good background knowledge, and you need to have very clear theoretical framework. And these things can help you make the decision whether those third factors that you consider in your analysis are mediators or confounders. So thank you for your attention. I really hope that these examples helped you have a better understanding on what confounding is.